Thank you for the opportunity to present our work today on the use of an Enuresis alarm to guide timing of post-void residual volume assessment in infants. On the right of the screen is a QR code that you can use to see our pilot study data that has already been published as a short communication in the Journal of Pediatric Urology. I have no conflicts of interest. An essential initial step in evaluating bladder function is documentation of complete bladder emptying. We often do this by obtaining post-void residuals or PVRs. However, an accurate post-void residual measurement should be performed immediately after voiding, but this is difficult to accomplish in non-toilet trained or nonverbal patients, such as infants or patients with severe neurologic impairments. In a series of studies, we sought to test the feasibility and efficacy of using an Enuresis alarm to guide timing of post-void residual measurements in non-toilet trained, nonverbal patients. In our Phase 1 pilot study, we prospectively enrolled 10 patients who were between 36 to 50 weeks post-conceptual age and were hospitalized in the NICU for postnatal, feeding, or respiratory care. An Enuresis alarm was attached to the inside of the diaper for 4 hours, with diaper checks performed every 15 to 30 minutes to assess for voids. Over the 4-hour period, the median number of voids was 3.5, which corresponds to almost 1 void per hour. In total, we detected 33 voids across 10 patients, and we found that the Enuresis alarm successfully activated in 31 of 33 voids, or almost 94% of the time. In other words, an Enuresis alarm detected more than 90% of voids in infants in the neonatal intensive care unit. In our Phase 2 study, we prospectively enrolled 2 groups. Group 1 consisted of 15 patients under 21 years old who were admitted to our hospital's complex care service and were nonverbal and diaper voiding. Group 2 consisted of 15 infants between 36 and 50 weeks post-conceptual age who were hospitalized for postnatal care, feeding issues, or respiratory concerns. All patients underwent an 8-hour study period. For 4 hours, there was a routine nursing period where PVR was obtained after nurse observation of wet diaper, and for another 4 hours, there was an alarm period where PVR was obtained after alarm trigger. Our primary endpoint was PVR volume as measured by our bladder scanner, and our secondary endpoint was the number of detected voids. In Group 1, the median age was 10 years, 7 out of 15 were male, the median weight was 20.7 kilograms, and the most common diagnoses were seizures or epilepsy, cerebral palsy, spastic quadriplegia, and gastric tube dependency. We found that on linear regression, use of alarm was associated with a mean decrease of 21 milliliters in PVR volume, and the median number of detected voids were significantly different, with 3 voids in the alarm period versus 1 in the routine period. In other words, we found that on average, the alarm was associated with 21 milliliters smaller PVR volume after controlling for patient weight and detected more voids in the older, medically complex patient population. In our second group, the median age was 6 weeks, 8 out of 15 were male, the median weight was 3.88 kilograms, and the top diagnoses were failure to thrive, feeding difficulties, respiratory infection or difficulties, pulmonary hypertension, and septic arthritis. Here we found that on linear regression, use of alarm was not associated with a difference in PVR volume in this infant cohort. However, the median number of detected voids was again significantly different, with 3 in the alarm period and 2 in the routine period. In other words, use of an Enuresis alarm resulted in detecting significantly more voiding events, but no difference in PVR volume in infants. In conclusion, we found that an Enuresis alarm can be used to monitor voids and allows for detecting significantly more voiding episodes. Specifically in the older medically complex nonverbal children, use of an alarm was associated with significantly smaller PVR volumes. Our next steps are to investigate whether more accurate alarm-guided PVRs in select populations can change clinical management, such as CIC recommendations, improve inpatient nursing workflow for urinary retention consultations by decreasing the number of measurements needed to evaluate bladder emptying, or potentially reduce parental anxiety by decreasing falsely elevated readings. Thank you.